Our speaker is my colleague, Dr. Justin Chi. He's the Director of Clinical Technologies here at Glidewell. And in addition to being a very accomplished clinician, he's also a skilled dental technician and a very popular and in-demand speaker. He's going to continue his new series, Thoroughly Reviewing Digital Dentistry. Remember, part one, we talked about tooth preparation, tissue management, restorative materials, and then we talked about digital impressions, and then we started talking about crown design. And there was so much material to talk about in crown design that we have extended it to another session. So it's my pleasure to turn it over to Dr. Justin Chi. It's all yours, Justin.
Thank you, Dr. Park, and thank you to our business panel, always delivering valuable information. And thank you all for tuning in. I'm going to share my screen. Okay, hope that's coming across okay. So continuation of digital design, one of my favorite topics. And yes, it is more thorough than we were anticipating. And I hope I can help relay and build the understanding of what is being done to your cases. How are these cases being generated through this CAD process or computer-aided design? And so I'm going to take you through a case that I just had last week. This patient, I don't have an intraoral photo, so we have the next best thing, which is our intraoral scan. So number 30. He has an existing crown on there. It was a porcelain fused to zirconia, so zirconia core with porcelain layered on top. And he had it for several years. And until recently, the last few months, he said that he's been having a lot of pain on biting. So pressure discomfort. And so evaluating the restoration, it did seem to have quite a few overhangs, and it's always hard to evaluate restorations once they're in place, right? Soft tissue inflammation on the buccal side. And whenever a patient has pain on biting, of course, we suspect potentially cracked tooth situation. And so we inform the patient that we are unsure of what's going on. This is the steps we're going to go through to figure out and investigate what the problem may be. So we removed the old restoration, and you can see it was previously endo-treated. And by removing the buildup, the original buildup, and there was a metal post, you can see there's very little tooth structure left. And I removed the old buildup because it was breaking down quite a bit. The next view here on the occlusal, you can see on the buccal furcation and involvement. Anytime I'm working on posterior teeth, I evaluate for where those margins are and whether or not there is furcal involvement. So I'm using either a neighbor's probe, which is a curved periodontal probe where you can access between furcation, or we also have a curved explorer that, oh, sorry about that. Let's see. All right. I was just informed that I think there's a mix-up on my screens here. I apologize. Let's see if I can get this sorted out. I have multiple monitors going on, so I want to make sure that you are seeing the right information.
We had you in presenter mode so we could see your next screen.
Okay.
There we go.
So you're seeing the design now, right?
Yes.
Okay. Let's see if I can switch back over. Digital dentistry and digital technical difficulties. All right. So thanks for letting me know. Want to make sure you can see ideally what is going on. All right, so back to the situation, wanting to evaluate whether or not there is furcal involvement. And as you can see, there was pretty extensive furcation involvement, and we want to ideally unroof that zone. There was inflamed tissue there. A lot of times with these bilayered materials like porcelain fused to zirconia or porcelain fused to metal, PFM crowns, those restorations can often be very bulky, especially if the preparation is under reduced along the those focal zones, or really any part of the preparation. So this is what was presented. I didn't come across any fractures in the preparation. And yes, there is quite a bit of loss of tooth structure. And I know many of you might see the situation and determine this hopeless. But as you can see, I opened up into the access channels. And since I am going to chairside mill this restoration, I'm not worried about provisionalizing this. So my restoration is actually going to extend into these access channels. So it's going to possess, in a sense, the post along with the buildup and of course the final restoration. So I thought this was an interesting case, and let me take you through the design here. And I just want to confirm that the design is on the screen.
Yes, it is.
All right, thank you, Nicole.
You're welcome.
All right. So once we open the case, if you tune into the last session, part 4, I went through the design process and how automated a lot of it was. This case, it's a bit more challenging because the preparation is a bit more unusual. But the first step of every design, whether it's in the lab or chairside, and I say chairside, many more dentists are adopting this technology and taking control of their design. So it is important for you to recognize what steps are required to produce a beautiful functional restoration. And so this first step is to identify the finish line. We're going to establish the margin for the preparation. Now, this is Glidewell's fast design software. They integrate an AI algorithm to seek out the edge of the margin. And as you can see, there is a red line around the preparation. And as long as you establish a nice sharp finish line, as well as good tissue retraction, the software does a pretty good job of locating where that margin ends and that margin position should be. But as you can see, there are some areas that do need to be modified because this is quite an unusual preparation with that focal involvement. So the way that we're going to modify and edit this margin line is, I'm going to zoom in a bit here. And as you can see, when I hover over the existing margin line, the red line, some zones turn yellow. And all I'm going to do is use the mouse and left click and drag this into a better position. We can modify the number of yellow dots that are moving and control the size of the adjustment. So this area along the furcation, since it's a bit of a tighter turn, it's harder to drag this into position. So an alternative way to edit the line is we can double click on a good area of the margin, and then I'll follow along the edge here and establish a new margin position. And once I connect back to the margin line, you can see the software will replace that segment. And here on the, let's see, that's the mesial buccal. So we're going to bring this zone down. Whenever you're designing, you can see how the software has these reflections embedded within it. So you want to take advantage of that as well. And also take advantage of being able to rotate around, viewing your preparation from different angles. The first part of digital design, one key skill set is to really understand the mouse movements and controls of your 3D model so that you can evaluate from different angles. And so we're just going to work our way up this mesial side. This looks good. Here on the lingual, checking it from different angles. And of course, you can turn it around. Hopefully, I'm not giving anyone motion sickness here. And we can view from a lingual side. So right now, the model is in a color mode. Most design softwares, as well as scanners, have the ability to change the model color or deactivate the color and turn it to stone. And so in the upper right-hand corner, I'm going to turn it off. I'm going to turn the color off so that we can visualize the model in stone. And there are some additional aids within the software. So right below the deactivation of the color, there's a tool called curvature, which will highlight edges on the model. So you can see it highlights everywhere, including the adjacent teeth, the soft tissue. But here we're focused on the preparation. And so on the lower right-hand side, I can deactivate the margin. You can see how if there is a sharp finish line created, which is what we emphasize whenever we're talking about preparation, enough axial reduction is going to give you that sharp transition or sharp finish line. So you can see how important it is during the preparation to create that fine edge so that it's easier for yourself to identify here in design. And this is where a lot of users, a lot of clinicians and their staff get hung up, and their design may take a bit more time because they're struggling trying to find and position this margin. So the better you can establish your margin during the preparation with great tissue retraction, if you are prepping subgingivally, this step will be much more efficient and much more straightforward for you. All right, so that is the margin. Let me turn the model back to color. I think many of us prefer seeing it on color. I'm going to turn off curvature. And once the margin is set, there's one more aspect we have to dial in, and that is to confirm the occlusal and buccal directions. This is essentially the software's compass. We are indicating to the software what is up, down, north, south, east, and west, occlusal, buccal, and this will feed into the software's design algorithm to generate, hopefully, a nice proposal. So on the bottom of the screen, I'm going to now left click on design, and the software is evaluating the adjacent teeth, the opposing dentition. You can see it says confirm the insertion direction. It's okay. We'll take a look at that later. And so you can see it's generating a crown AI. And the last session, we went through a couple crown cases where the AI generated really, really nicely. But I have noticed our software still hasn't seen enough of these situations that involve this furcation in such a strange foundation. And so you can see the tooth came out, it's close, it's just a little lumpy. And so anytime there is a distortion like this to the software, I advise our users to start off with the library tooth. So I'm going to show you exactly how we do that. So this is a bit more of a challenging design. So on the left-hand side of the screen, we have our column of tools. I'm going to navigate to the first icon. It is called Proposal. You can see how it pops up with Proposal when I hover over it. And here in the dropdown, we can see different options for our design. So you can see it starts off on Crown AI, which is artificial intelligence, which was what generated originally. We're going to change this to library. The second option is an embedded generic library for the tooth you're working on. And the third option is copy restorative site anatomy, which I'll show you on the next case. So I'm going to go to library. The copy restorative site anatomy, as the name implies, is to copy a scan of the preoperative condition or perhaps a wax up. So once I change to library, there's an additional adjustment that we can make. So I'm going to click on adjust in the bottom. And then now I'm going to turn off the design for a second, and let's just analyze this here. So we have this void where number 30 is position, right? We have this void, we have adjacent teeth, we have the opposing. Our goal is to establish a design that occupies that space with great contacts, great positioning and contact with the opposing. And so that's what we're going to establish with this library positioning. So let me reactivate the design arch or library arch. And so you can see this tooth here, it's just a complete generic number 30. And we can make adjustments to the position, the angulation, as well as change and modify the size of this library tooth. So you can see we can just drag this around. And as I raise this upwards, you can see how it reveals any potential contacts with the opposing. So we can view it from the side here. Actually, from this buccal view, it looks like it's kind of angled to the mesial. So you can see these handles around the design. And so each section has 3 different options to modify this library tooth. So I'm going to use the circle and rotate to the distal. And you can see the occlusal plane of the adjacent teeth. So it's always helpful when there are adjacent teeth to guide your design. And so you can see the occlusal plane, how that is adapted and factoring in the curve of spee and positioning the arch. This will impact the long axis angulation for our library teeth. So you can see that's about even there. The distal typically slopes down just a bit. So from this buccal view, that looks better with the angulation. Let me rotate back to an occlusal view here. And from the occlusal, we want to ensure that our library tooth is centered over the preparation, number one. So you can see if we're off center, reposition it, make sure we're about center over the prep. And notice how on the handles, there's a green arrow. We can expand that design to establish our proximal contact. And so this would be open. And here we can get the size mesial distally into contact with those adjacent teeth, which will dial in even further once we apply this library tooth. The next view that is important is from a mesial view here. And here from this mesial side, we can also see the occlusal planes of the rest of the posterior teeth. And notice how the lingual cusp tips are a little bit higher than the buccal. And so we'll use that rotational control and lower the lingual. We're going to rotate that to the right. And now you can see the occlusal plane matches the adjacent teeth much better. And you can also see the contact with the opposing. So just looking at the design with the adjacent teeth, we have good contact. The size of this tooth occupies most of the space buccolingually. Contact with the adjacent teeth. The size is close to the adjacent teeth. And let's just look at the opposing once again. We want to establish a good cusp-fossa relationship. Look at the adjacent teeth and how on the lowers, those buccal cusp tips are flowing into the middle of the upper teeth, or the upper teeth are kind of more buccal to the lower teeth. So this is our patient's normal occlusion. We can see on the opposite side, this is normal occlusion, great cusp-fossa relationship with the buccal cusp tips being the functional cusp and position in the central fossa of the opposing. Let's look at it from the lingual, just so you can see that from this view here. I may cut away the other side of the arch. As you can see, we have a full arch scan, which isn't necessary for a single full coverage or single restoration, but we just have additional detail there, and we can trim it in the software. So here you can see how the lingual cusp tips of the opposing are coming down into the central fossa of our design, and that's what we want to establish. All right, so that is how to position the library tooth. Once the size, angle, and overall position of that library tooth looks good, now on the upper left-hand side, we're going to hit apply. And so once we apply it, you can see how it takes that original starting point and reaches for the margin. So it seals the margins that we set on the previous step. And then now we're going to go step by step to establish the proper function for this design, proper contact, getting nice broad contacts, as well as evaluating the contours of this restoration. All right, so let's just get an overall look. Actually, I said how I want to cut away. Let me just show you that. Most design softwares have a trim function. I'm going to go to this tool called Scan Repair. And the scissors here will allow for a cut of the model. You can see how it protects the preparation in red. And that just allows us to view it like this, straight on from the lingual. So we can evaluate the cusp height with the adjacent teeth. So there are automated functions within the software. Let's start there, and let's just see how the software generates the restoration. Actually, I noticed something is missing our mesial contact. Let me go back to our library, and let's see. I need to reset this here. I noticed that number 29 is missing. Yes, it's kind of an interesting thing. Anytime a restoration is missing from the arch, the software for some reason loses track of the contact with the adjacent teeth. So I'm actually a bit perplexed. Why 29? Oh, I hit yes. That's why. So no, I don't want to remove 29. Let's do that over again. It let me know that it was trying to hide 29. So notice how there's some ghosted teeth over the adjacent teeth as well. So if those ghosted teeth, if the ghosted teeth are basically informing the software that there are in fact adjacent teeth. That's just the way that the software was generated and established. It uses that for positioning of your library tooth and design, and also for establishing contact with the adjacent teeth. So let me just quickly get this library tooth back into position. Remember, we lowered the lingual down a little bit. The reason why the buccal might be lower is perhaps due to the original occlusal position that I had set on the previous page. Maybe it was just angled slightly to the buccal. All right, so let's go and reapply. So again, getting the size, position, and angulation. And notice how now that ghosted tooth came back over 29, we have a number over the mesial. So we do want to try to get a contact number so we know exactly how heavy the contact is. All right, so we'll review the contacts here. So once our design is generated, you can see how the software, whenever we navigate through this library design process, after we position, size, and get the correct angulation, once we apply it, it just drops that tooth into position and reaches for the margins, and that's it. It doesn't adjust the contacts. It doesn't make any other changes to the design. And so it's basically like riding your bike without training wheels. So the original AI does kind of take into account the adjacent teeth and get your contacts set to your default settings. But in this case, the library workflow, it's training wheels off, driving with your traction control off. There's a bit more manual adjustment, but I'll take you through that step by step. So we have our design, it's positioned well. That's really the most important thing. We have contact with the adjacent teeth. We have numbers over our contacts. So let's get our contacts dialed in and occlusion dialed in. All right, so let's try the automated function first. So we have our contacts window here on the left. It opens by default. And you can see how the numbers, there are numbers in the boxes of the contacts window. Once you acquire this system, these are the default values that are provided for you. Now, these default values are what we consider to be close for most cases, but every clinician may have a different preference. Some prefer the contacts to be heavier. Some, of course, want them light. More adjustment. I'm more along the lines of that end because we do a lot of cases, and minimal adjustment is always much more much satisfying and pleasing even to the patient, of course. So these values, every office might have a different number. And so once you first try a few cases and your restorations may be heavy at first, you can of course adjust these numbers to that sweet spot that works for you. All right, so and these are the default values. We'll use this as our baseline here. So we have 30 and 30 for the mesial and distal contacts, and -200 for the occlusal. So these numbers are in microns. It's essentially how much we're pushing against the adjacent teeth, and also the distance perhaps from the adjacent teeth or opposing. And again, these numbers, it does factor in the calibration of the system. It also depends on the patient's bite, how well you capture the bite during the scan. If the patient slightly opens during that bite scan, that could also lead to some inaccuracy in the final restoration. So just some things to keep in consideration. So we have our values set. If you needed to change them, we'll change it, but we'll keep them on the default values at the moment. On the very bottom of this window, we have edit mesial and edit distal. These tools allow you to control and set the broadness and position of your proximal contact. So let's start with edit mesial spot. Once we click edit mesial spot, notice how it takes us to a straight view of that mesial neighbor. And again, using the highlights of the software, notice how we have a reflection on the distal surface of 29. That is indicating a nice broad area, but let me show you from the occlusal. Before you define the area of the contact, I recommend looking at the adjacent teeth and seeing what area is facing your design. And so the software knows that it uses the straight distal or straight mesial, but you want to get an idea before. So just to show you, we use our mouse to draw it. Before you draw, you want to understand what surface is facing your preparation. Because some adjacent teeth might be rotated and it may affect the true positioning of that contact. So we're going to get a nice broad contact over this flat area that's facing your prep. And going back to the preparation, hopefully this helps you understand how you need to establish really good adjacent surfaces for your cases. So we're focused on the tooth we're prepping. But as we're prepping, before you take your scan, you don't want to forget about evaluating those contact surfaces of the adjacent teeth. You may need to modify that in some way. If it's overlapping your margin, that's going to be a big issue with your final restoration. If that surface is rough, that will also not allow for you to create a nice, solid, broad contact in your restoration. So make sure you check those areas out. We ideally want more of a flat or convex, large convex surface that our design can adapt to. So we're going to draw this contact around here. We don't want it to be too large where the software could actually begin to cause the design to hug the adjacent teeth. So we're going to draw that large area there on the mesial. Let's check out the distal. Nothing's happened yet. So we're going to look at the distal spot. This looks pretty good. But again, we're going to look at it from the occlusal, understanding what area of our adjacent tooth is facing the preparation, facing your design. And we're going to allow for the software. We're going to draw the contact like this. Not every software has this functionality. It's nice that we have this ability to define the contact. And then to establish the contact now, what we're going to do is press fix contacts on that contact window. And now the software is going to do its thing, wiggle that design into position. And notice how it not only adjusted those proximal contacts, but it also lowered the occlusal surface to the predefined contact value of -200. And so let me go to this buccal view here. I'm going to undo for a second, and you can see those areas in red. And just to show you, I'm going to hit redo so you can see exactly what was done. Contacts expanded, the occlusal was lowered. Very little work to be done at this point. So let's go ahead and, or not much additional work required for at least the contacts. Everything looks really, really nice. So let's evaluate the contacts here for a second. When it comes to our design, we want to establish optimal chewing efficiency. Now, some of you might be looking at the occlusal contacts here, which are indicated by these colored areas on the occlusal. You can see we have contact on the mesial buccal, distal buccal, some areas on the marginal ridge, distal and mesial marginal ridge, this mesial triangular ridge. And notice how we don't have any contacts here in the center. I know if you look at a lot of occlusion textbooks, we often hear about trying to have tripodized occlusion, but it really is dependent on where the patient's opposing dentition is. So let me bring about the maxillary model. And notice how the opposing first molar, the mesial lingual cusp, is touching more on this distal lingual area of the restoration. Let me trim away the other half of the maxillary here because that's also affecting our view. Okay, let's go back to our design. So notice how right in the center, there is an inability to create a trapezized position. So if you wanted to adjust and modify the positioning of your contacts, there are additional tools here. So on the left-hand side, there's a tool called Sculpt. And just to show you, sometimes if you wanted to increase the broadness or positioning of the contact, maybe you can adjust and raise a triangular ridge, but you can see no matter what you do, there's no contact here because of this occlusal embrasure between 3 and 4. And now we have our contact primarily located on that distal lingual. So just something I wanted to point out to you, maybe for most of you probably sending cases to the lab, you're wanting this ideal position of the contact, but you have to consider the patient's current dentition, where those areas are. All right, so this is where our occlusal contacts are. Let me evaluate the contact, the proximal contacts. The broadness looks pretty good. Something else that I also like to try to establish, if we can, are marginal ridges of our restoration, even with the marginal ridges of the adjacent teeth. Notice how the marginal ridge on the mesial is a bit lower than the premolar. And so let's say we wanted to raise that up. And some of you might have that same preference, but you send the case off to the lab and then your restoration comes back with a really low marginal ridge, like in this case. If we go back and evaluate the opposing, notice how on number 4, that lingual cusp is dipping down a bit further over our number 30, over our design versus number 29. So in this situation, if you have control of your design, you may want to raise the marginal ridge and have this position here, and then perhaps inform the patient that you're going to modify the opposing tooth or restoration in this case to accommodate for that raising of that marginal ridge. So this is just something that you can adjust. And again, being able to visualize your design yourself and take control over these attributes is a really nice thing. All right, so here we can intentionally raise that marginal ridge. Again, it's showing that it's going to be a heavy contact, but I understand that when we go to seat the restoration down, we're going to adjust that opposing restoration. Now, looking at the lingual cusp tips, you can see it's a bit low compared to at least 29. So here, I often like to have the lingual cusp tips a bit higher. And as you're getting into the design game, you can find your favorite morphology book or check online for your ideal design contours and shapes, and that you can have it next to you and just kind of double check that your design is kind of going according to plan. Everyone has, I think, a preference for their design tooth. And so when I raise that mesial margin ridge, I can see that that mesial side is kind of opening up. So I can close that contact there. All right, so from this occlusal view, once our contacts, the broadness of our contacts are set, the chewing efficiency and occlusal stability, identifying that ideal cusp-fossa relationship, then from there, I'll check the axial contours and emergence profile. So from this occlusal view, notice how we can see how the buccal areas, it looks like it's dipping in a bit. Again, we had our library tooth set for this design, so it doesn't often factor those in. So here, using this tool called Freeform, I can raise and bring those zones out. I like to have a bit more bulk there. And on the lingual side, you can see how it dips in. We can adjust the size, and I can change the contour really, really easily. So not only can we change the cusp tip position, we can also adjust those contours of the restoration, virtually any part of this restoration. Now, there are oftentimes a lot more things that I like to change, including the positioning of the primary anatomy with lower first molars. You can see I often like to have that central pit near the middle, kind of have the lingual sides of the tooth kind of tapered in a little bit. And here I'm going a little bit, I know, a bit more manual here. I like to have this distal cusp occupy most of the distal contact area. And so, again, this is all a bit subjective. And so little tweaks like that. I know by repositioning that distal cusp, I made it heavy. Let me take that down. Mesial marginal ridge is heavy, as we talked about. And notice how I made that contact heavy. So what we can do is let's return to the automated contact. And what we can do is deactivate certain parts of the restoration. So we intentionally want the occlusal to be heavy on this mesial side. And so if we just hit fixed contacts, it will modify that again and lower it. But here we can turn off the occlusal and just hit fixed contacts. And now the software is going to adjust those proximal contacts down back to the value that we wanted. And so when I reactivate the occlusal, notice how it left that area alone. Let me hide the model and notice those extensions of our design into the canal space. I'm going to go to a tool called Smooth, and this tool is really nice for refining your design. I just noticed a bit of a sharp area on that distal contact that I can smooth out. And I also like to ensure that these occlusal embrasures, the area above the contact, we have a little bit of an opening. It's going to be more floss friendly. It's going to be easier for us to clean and pass our floss through after we deliver the restoration. And so just lightly running the smooth, especially when we have more flat contact areas over the adjacent teeth. That is important, that we want to try to open up. And perhaps any squared off areas of our design, but this is essentially it. So once our design is finished, let me show you one more important aspect when it comes to delivering these restorations, and that is the insertion direction. We have a relatively short prep here. So here we're in the insertion direction area where in this tool, the software will reveal any potential undercuts over the preparation, as well as the adjacent teeth. And so when you evaluate this insertion direction, this path of insertion, this green arrow that is pointing through the preparation, that is basically identifying what is the direction the burr is facing when it's milling the intaglio of your restoration. And so it's really important to understand that fact and adjust your preparations according to how the milling machine is going to create these restorations. And also when you see the adjacent undercuts over the adjacent teeth, those red zones, you also want to ensure that your contact areas of your design do not fall within the undercuts of the adjacent teeth. And it is helpful to know if you do have the design on hand, if you perhaps are having an issue seating the restoration, it very well may be because your design is generated within the undercut of the adjacent teeth. And if that is the case, you can go back with one of the tools if you are still in design and smooth those zones out and just lighten those contacts and just remove the material from within that undercut to make it a bit more easy to seat that restoration. All right. I spent a bit more time than I was expecting on that design. Let me go back to the presentation here. I may have time to just quickly go into the next case. All right, so let me show you here the final. So this was the final restoration, and in our next part 7, where we're gonna, or part 6, we're gonna dive into more of the actual materials and milling. But in this case, this was a Bruxer now, which is a monolithic chairside zirconia that you can generate with the Glidewall milling system. And here on the buckle, you can see this buckle view. This was immediately after delivery. You can see how that furcation area is generated. Some clinicians I know, when they barrel the furcation, like in this case, they like to carry that barreling all the way to the occlusal, where it's kind of this vertical ditching on the restoration to help with cleansing. I'm not a huge fan of that. I just bring it up, as you can see, maybe halfway up. Yeah, it's still not a normal looking tooth. It's going to be much more cleansable for the patient, but I still like the occlusal to still have some bulk to it. So I think it's personal preference, but ideally we're going to, in this situation like this, inform the patient that there is a bit more attention required to clean those areas out. And it's only been a week for this patient, but I'm happy to report that the pain that he was experiencing did go away. So it did seem like a lot of that pain was concentrated in that furcal area where that original restoration had that overhang. The soft tissue was really inflamed and irritated. The next case here is my 90-year-old grandmother, special lady. She came to me and said she had a pain on her lower right. You can see this is, I think, 31 or 32. You can see some recurrent decay under that existing restoration. Her original restoration was used as an abutment for her partial. So this is often one of the challenging situations, trying to make a new restoration to fit under an existing removable appliance or partial. So when we go this digital route, it makes it much, much easier because we can scan that original tooth, that preoperative tooth, before taking it off and use that contour and anatomy for our new restoration. And so once we take off the old restoration, you can see the amount of decay there on the mesial. After we clean that up, another furcal involvement, packing core through that furcation. Very little tooth structure left, but I want to try to save the tooth for my grandmother. So let me quickly go through this design. We have the margin mostly placed. I won't spend too much time on it, but here on the buckle, I do want to get around that furcation. So let me double click and just run the margin where it should be. And once the margin is set, we're going to go to design. And then here, through our software, any posterior restoration does generate first using the AI proposal. And another challenging situation for the AI, but that's okay. We're going to go to the third option. So upper left, we're going to go to copy restorative site anatomy. And this function, you can see this is the scan of the preoperative tooth. So you can see the nice rest seat on the mesial side. In this section, this allows us to define what part of the preoperative tooth we want to copy. So as I am modifying this, what I'm doing is trying to include as much of that preoperative tooth while avoiding voids in the model. So you can see there's a bit of a missing place there on the mesial. So I go above that. And on the lingual, there's also kind of a bit of a distortion. So we're going to go around that. And a little tip for you, the scanning of this case was really difficult because her original restoration was extremely shiny, that alloy that she had. So when the preoperative or any situation when you're scanning, if it's really, really shiny and reflective, some scanners have, or most scanners do have difficulty capturing it because scanners rely on the reflection of the light back to the camera to generate the 3D model. Too much reflection is also bad, which is why we want to turn off our overhead lights and reduce the amount of ambient light into the intraoral space. In this case, we applied a little bit of occlude, the occlusal or intaglio check spray. It's really fine spray, and that did dull the restoration down quite a bit. So I'm going to apply the copy. We're almost done here. Once we apply it, the software does an incredible job of taking everything above this line, everything you see in yellow, and adapts it to the margin that we had set on the previous step. And with no adjacent teeth, this is going to be really easy. We don't have to adapt the adjacent teeth at all. The main thing we do want to consider is perhaps the occlusion. Let me turn off these undercut warnings. Yes, there are some undercuts on the prep. But you can see the main thing is to make sure there's no distortions on the design. It adapts well to the prep. And we want to ensure that there is minimal thickness. The minimal thickness requirements are being met. So you can see a little bit of red area here on the buckle. For our Bruxer crowns and our glass ceramics, our minimum thickness, our Bruxer restorations, monolithic zirconia, we have a minimum thickness setting in the software at 0.5 millimeter. For all other materials, it's actually set to 0.7 or 0.8 millimeters. But with other materials like glass ceramics, hybrid resins or composites, or PMMA, you want to err more toward 1 millimeter or greater in your final restoration. And it is also factoring in the cement gap. So digitally, we didn't really have time to talk about that, but there is a cement spacer that is created to allow for room for the cement to occupy between your restoration and your prep. So on the contacts window, there's a tool called Protect Thickness. Notice how when we hit that, the software will automatically add to the areas that are thin. And I'm going to turn on this pre-treatment to show you how nicely the software copies that original tooth. And let me go back to our presentation here, and you can see the final restoration and how nicely we were able to get a Bruxer crown milled out in less than an hour for my grandmother. It adapts to the exact same contours, to the clasp and that rest seat and guide plane for her partial. So it was real straightforward. Copy, single visit restoration for my grandmother, and happy to report she's no longer in pain. And I was hoping we could get through an anterior case, but unfortunately I went a little long on the first couple cases. So I'm going to check back in with Dr. Park to see if there are any questions.
Thank you, Justin. That, this whole idea of making a crown underneath an existing partial without taking the partial away from the patient. I mean, that to me, that is such a valuable tool and such a great reason to have these kinds of capabilities in your practice. So thanks for showing that to us. Absolutely. I do have a couple questions for you. It looks like this idea of incorporating the post and build up within the crown is something that you do routinely. And obviously you don't have any mechanical retention in this, otherwise you wouldn't be able to have any draw. So do you have more faith in bonding materials than I have? I mean, that's you feel like these things are very stable and they're not going anywhere?
I feel they're very stable. I'm really confident in our bonding protocol for zirconia restorations, which is to air braid and create that micromechanical roughened surface and the proper chemistry. We're going to dive into the delivery and bonding in a bit more detail in a couple more sessions. But yeah, the optimal bonding protocol is creating a roughened surface, MDP primers on the zirconia and resin cement. And so far, knock on wood, it's worked out really, really well. We do a lot of zirconia veneers with minimal retentive preparation. So it's been great. And
I love the way you handle the Ferkel involvement. That's really, really nice. And I agree with you. I don't think you need to barrel out the crown design all the way to the occlusal, because I think having full contour in the occlusal actually keeps food from impacting into the Ferkel area. So I like the design that you have there. Very good. Thank you. Here's an interesting observation. One of our attendees is saying that, watching you go through all these steps in the design gives him much more appreciation of what the technicians at the lab do when they design and fabricate the digital crowns. But, he's questioning, with all this work, wouldn't it be possible that it's more worthwhile to spend time treating patients and not doing this kind of work in your clinic? What do you, obviously you work with a lot of practices that incorporated this. How do they work that to make sure that they're optimally using their time?
Absolutely. Clinicians' time is best spent working on patients, getting the proper treatment done. Many clinicians do see that value in working on the design, and many enjoy it. But I would say the majority are delegating someone else in the office, a dental assistant that is properly trained, of course, to take the case through to completion, and perhaps the clinician jumping in and verifying the margin and verifying that the occlusion positions are correct. And this was a bit more of a challenging case, and that is dentistry, right? Not everyone's teeth are in the ideal position. The software, for the most part, when you have a traditional preparation, it does generate the design really nicely, as you can see in the last session. But today I wanted to take you through a bit more challenging and see, okay, how do we work through those complications and still create a nice functional result?
Yeah, I think you're absolutely right. I think that the proper way to incorporate this into your practice is not for the doctor to spend more of doctor time doing this than he would otherwise in the procedure, and that there should be a way to delegate most of this task, and the doctor, the doctor's the supervisor and does not do all the tasks. So
For
yeah.
sure.
Question about a learning curve. How long will it take me till I'm a real good crown designer?
Well, the goal with the software is to not have to spend too much time with it. I know that didn't really come across today, bit more of training wheels off, but to become proficient at it, we see in about 5 to 10 restorations. And if you do adopt this system, we have an amazing support team that you can phone in, and they can walk you through as many cases as you want to help you, more simple cases optimally, and show you how easy it is, and reinforce what you are trained on when you do get the system. And of course, we have follow-up CE as well.
Absolutely. And I know, like, when people come in to take your advanced courses, and when we have our .iox symposium, that these folks are raving fans. They're raving fans of the ability to bring this into the practice and what it does for the practice, how it increases production, how they get to do crowns that they wouldn't do otherwise because of the one visit advantage, the patient not having to come back twice. So it's we've certainly have seen a lot of doctors incorporate this with extreme success in their practice, and we certainly have seen you make a lot of practices very adept with these procedures. So your educational contribution is key here.
Happy
So
to do
Dr.
it.
Justin Chi, thank you again.
Thank you.
And thanks everyone for joining us, and thanks to our panel. And we'll see everybody back next week when we'll have, as always, our business advisory panel. And our guest speaker will be Dr. Stephen Barrett with another one of his very practical clinical lectures on aesthetic dentistry. So let's meet back here next week, same time. See you then. Thank you, Dr. Chi. Take care, everybody. Bye-bye.
Thank you.